Hello, my name is Aracelia Denhalter, and I'm a patient navigator. As a patient navigator, it is my goal to reduce barriers that patients face while navigating the healthcare system. These barriers can look different for each patient. However, some of the most common barriers are financial barriers, transportation barriers, and mental health barriers. Today, I will be discussing how I can help decrease these barriers when it comes to stress management and how to best manage stress. So, what is stress? Stress is the body's response to any demand made upon it. We experience stress as soon as we are born. However, the way that we manage stress and the stress that we experience looks different throughout different phases of our life. For example, the stress that you may have experienced when you were 7 years old looks a little bit different than the stress that you experience when you're 37, just because of your environment, your experiences, and the responsibility that you assume. Stress doesn't have to be just negative, but it can also be positive. So, why should we care about stress? Well, we all experience stress. Stress has no age limit, no gender, no ethnicity, no specific duration. It's worldwide, occurs daily. It can be negative or it could be positive. It could have multiple contributors. So, stress affects us differently in varying amounts, and it affects everybody. Everybody experiences stress. Stress typically happens on a daily basis. However, the intensity of stress is what can vary. Stress can be extremely intense, especially if it's something that you care about very much, or if it's something that has very intense repercussions. Duration of stress can be different based on your mindset, based on what is causing you stressed, and just based on the type of person you are, your experiences, and how you react to it. The onset of stress again can look different. It can look something that is dealt with more internally or external pressures such as deadlines and whatnot. So, to look at some of the causes of stress, school and work are the main cause of stress in individuals. At work, if you are understaffed, it can put a lot of pressure on you as you probably assume more responsibility than normal just because of the lack of number of employees. For both school and work, extensive workloads, extensive hours, and little to no time off or breaks can cause a lot of stress as it leads to something called burnout. Burnout is basically just the exhaustion from being overworked with little to no breaks or time off to recuperate, regenerate, and regain some of that energy so that you can reallocate it towards your work. Deadlines can put a lot of pressure on people. That time constraint puts a lot of pressure because it requires you to get your tasks done in a specific amount of time. And things that are performance based, such as tests or needing to meet a sale quota, can cause a lot of pressure for people, which can increase their stress as it requires them to meet a standard or a level or an expectation. And if they feel as though they're falling short for that, then that can lead to a lot of stress. Finances can cause a lot of stress, especially if you're assuming responsibility for other people. Now you have a lot of bills to pay, such as groceries, electric bill, car bill, phone bill. And these are all just essential things that we need to survive now. And when you take that responsibility and place it on yourself and multiply it by multiple people, for example, if you're trying to provide for your children or for your loved ones, that can cause a lot of stress because the pressure isn't coming from just your state, but coming from maintaining the environment for others. Additionally, taxes cause a lot of stress for people, especially if they're already feeling financial pressures, because this is a pressure that has criminal repercussions. For example, if you fail to pay your taxes, then you could possibly be looking at jail time or further financial burdens due to penalties. Another cause of stress is relationships. This can be romantic relationships, this can be friendships, this can be relationships with your family. especially in the case of bereavement. If you're experiencing the loss of a loved one, this is a lot of emotional stress as you're mourning the loss of someone. You won't be able to interact with them in person anymore, and this can cause a lot of emotional distress for people. Divorce is one that encompasses both emotional stress and financial stress. You have the financial stress of employing lawyers to deal with it legally, but then you also have the emotional stress of ending a personal relationship with somebody who chances are you have put in a lot of emotional energy, and for that to end can cause a lot of stress, as that detachment can be very very emotionally burdening for individuals. Additionally, parenting, whether you're a new parent or you have multiple children, can be very difficult for people to navigate it, especially if you're doing it alone. Single parents, a lot of stress because you're assuming the responsibility of your children. And if you may not have somebody to share that responsibility with, it can be very taxing. Health can also cause a lot of stress for individuals. We all deal with health and we all deal with aging. Aging is everybody experiences aging, but it can be very stressful as it's difficult to watch your body essentially deteriorate. You're slowing metabolic processes. Maybe you can't do things that you used to be able to do. It can be very, very emotionally taxing and very stressful for people, especially if they need to rely on other resources. This can encompass chronic diseases or just an overall decrease in well being. Sometimes chronic diseases are unexpected. For example, if you get diagnosed with cancer, this can be very stressful financially because you're dealing with the insurances, dealing with affording care. You're dealing with the time allocation for treatments and doctor's appointments and getting in contact with doctors. But you're also dealing with the emotional side of it where your future becomes a little bit more unknown. You don't know how your body's going to react to cancer, to the treatments, and how you're going to be able to sustain well being and improve your condition, which can be both emotionally but also very physically taxing. Additionally, mental health can cause a lot of stress. Those with anxiety and depression and other mental health disorders are predisposed to vulnerability to stress. So, some of the solutions to stress and improving stress management begin with the provider. The provider needs to find a way to understand what their patient is going through and how they can best assist them. This can be done through motivational interviewing. Motivational interviewing uses many different skills like positive reinforcement, asking questions, and empowering the patient to not only understand their condition, what best solutions the provider can present for their patient, but also empower the patient to improve their self efficacy. It's important for the provider and the patient navigator to educate the patient on what stress is and different management techniques, improving a patient's understanding of stress and trying to shift that stress outlook to a positive one can increase their basically just how they respond to stress and that stress management. Also, it is important for patient navigators to present their patients with realistic coping techniques for stress management. This can look different for each patient based on financial barriers, transportation barriers, their interests. For example, some people may not want to go on a 5 mile run to release their stress. It's important for patient navigators to know that so that they can show them other techniques and outlets so that they can help manage their stress, such as therapy, getting them in contact with an online coach, maybe if they don't have the transportation to go to a therapist in person, or if they have strong relationships outside of their family and friends, then you can stage an intervention to try and help with maybe some self destructive behaviors that are increasing their stress levels. So understanding the patient is important from a patient navigator standpoint for stress management. I felt that as a patient navigator, I adequately explained why stress management is important. I did this through explaining what stress is and the implications of stress. I explained how it affects all people and that this is the main component as to why understanding stress management is important because the scope of who it affects is worldwide. Thus, being able to provide efficient coping mechanisms is very important. I thought I gave a sufficient explanation of what stress management looks like and how there are different steps to stress management, like understanding the patient, educating the patient, and then implementing those techniques. The practical solutions that I encompass were exercise, giving adequate therapy for the style that the patient may need. However, with something like stress management, it's going to look very different for each patient on their circumstances. So, giving one specific remedy to all types of stress is unrealistic because of some of the barriers that different patients experience. I found that I did a very good job explaining why patient navigators and providers should concern themselves with stress management. I think I could have improved on how negative stress management can affect patients and how there are extensive health implications to improper stress management. However, I chose to try and focus on a more positive outlook of things that providers and navigators can encourage patients to engage in to try and help manage that stress and try and focus on more the root cause. As a patient navigator and a future provider, I feel that it is very important to identify root causes to different problems that occur in patients. If you're able to identify the root cause, the likelihood of recurrence or improper management decreases because you're not treating the symptoms, but you're treating the actual cause of the symptoms, which allows you to manage both the condition and the symptoms rather than just the symptoms. Thank you.